Hello, and thank you for clicking on this link and joining me for this short presentation from SOS Berks related to opioid use in our community. I know many of you, like me, are at home and focused on the ever-changing news about the coronavirus. And while COVID stopped many of us in our tracks, our family and friends who are struggling with an addiction are still struggling even during this pandemic. We at SOS Berks thought it was important to continue to provide information and resources related to the opioid and other substance use disorders virtually, since we can't meet in person. We know that the pandemic didn't shut down addiction, and in fact, we actually know that things have been made worse. So this presentation will hopefully provide you with some important information you may need to help people in your lives who may be struggling with opioid use. My name is Cory, and I am the Senior Director of Education at Care and Treatment Centers. I'm also a volunteer member of SOS Berks Opioid Coalition, and I'm part of the Education Subcommittee. For our time together, our plan is really to do a brief overview of what stigma is and how that impacts this crisis, what the opioid crisis is doing in our Berks County community. I want to talk about how naloxone works and review opioid overdose-reversal training and give you some resources before we leave. So very quickly, I just want to explain what is SOS Berks, because I think we might be one of the best kept secrets in Berks County. But we are really a collection of people who are invested in providing resources to our community and education to raise awareness, stop the stigma, and end the opioid deaths in Berks County. We are made up of a cross-section of different kinds of community members. We have some concerned citizens, we have treatment and healthcare providers, we have government officials and law enforcement coming together, the Council on Chemical Abuse, Criminal Justice Advisory Board, and the Berks County Commissioners, all coming together to work together with one common mission, which is to improve and save the lives of Berks County residents. We get together about once a month, every month on the first Friday afternoon, and we are divided into 5 different subcommittees. There's a community outreach committee, a data collection committee, my committee, which is the Education and Prevention Committee, Healthcare and Treatment, and Community and Safety. The goal of the Education Subcommittee is to really just provide targeted prevention and education that will end opioid deaths in Berks County. So let's get started. Like I said, I really just want to give a brief overview of what stigma is and hope to try to relate this to how stigma impacts the opioid crisis in Berks County. So really, stigma is defined as a set of negative beliefs that a group of people in our society holds about a topic or another group of people. And it's based on assumptions, preconceptions, and generalizations. Just about all of us know someone struggling with addiction, whether we realize it or not. Opioid and other substance use disorders can affect anyone, but addiction doesn't define who that person is. All too often, our family members, friends, and neighbors in Berks County suffer in silence. Fear of being judged and outcast prevents them from seeking treatment. So what we can do about that is offer words of encouragement, hope, and support to break through the negative perceptions that prevent people from seeking help. Stigma really is the thing that stops people from coming forward and getting the help that they need in order to address their opioid use disorder. I think testimonials are very powerful to help break down some of those thoughts and negative beliefs that we have about addiction. And so I encourage you to go to SOSberks.com and play a testimonial. testimonials are actually probably one of the most effective ways to reduce stigma, and it really brings a face to this disease and makes it more personal. So, we're very thankful that we have some people who were willing to share their story, and they are all Berks County members. So I, again, encourage you to go to sosberks.com and watch one of their stories. So let's just jump right into information about the opioid crisis. Let's start by talking about what are opioids. So opioids are made from the opium poppy plant, which is grown, but they can also be artificially produced in a lab and have similar effects as the plant would have. Opioids, the term opioids refers to both naturally grown drugs and man-made drugs. So opiates, if you ever heard that word, which is often used interchangeably with opioids, but opiates in technical terms refers to those that are organic only. So you can see some pictures of the poppy plant and an example of a synthetic opium derivative that's created in a lab. We have prescription drugs that are created from opium or in a lab that are codeine, tramadol, oxycontin, Vicodin. Perhaps you've heard of some of those, as well as powdered heroin, black tar heroin, a fentanyl patch, which is a prescription drug. So there are a lot of different types of opioids that are out there. One distinction that we like to make is the difference between street drugs versus prescription drugs. All street drugs are illegal as far as opioids are concerned, and nobody really knows what they're purchasing when they purchase from a drug dealer. The strength and quality of the drug vary from dealer to dealer, and there's no quality control. Nobody's checking. There's no FDA involved to make sure that the purity or the strength of the substance that's included is the same. And what happens is heroin is often mixed or cut with substances like fentanyl or carfentanil, which is the elephant tranquilizer, stronger than fentanyl. And they're cheaper. They're actually cheaper for drug dealers. So they include things like fentanyl and carfentanil, which can be very fatal to the end user. However, I don't want to say that prescription medications are not just as dangerous as street drugs, because they are. An individual can overdose on prescription medications just as easily as they can on street drugs, particularly if they are not taking the prescription as prescribed. So they alter the dosage or the frequency of the medication, and that can lead to an overdose as well. So let's talk about what is an overdose. An overdose happens when a toxic amount of the drug or a combination of drugs overwhelms the body and causes it to stop breathing. An overdose is really a result of asphyxiation or limited respiration. In 2016, which is around when SOS Berks began, there were 118 fatal overdoses in Berks County. We saw that number decrease slightly in 2017. And then in 2018, we had a big drop, and we're really excited about that. We were thinking that our efforts were really working well. But as you can see in 2019, the trend went back up, and there were 109 confirmed cases prior to the coronavirus starting, and with 20 pending investigations. So the final number on that has not yet been confirmed, but clearly we're seeing a reversal in the downward trend that we were hoping for. So what does it look like when someone is high on opioids? It's really important to understand the signs of opioid use and also the signs of an overdose, so that you know how to act if you see someone in this state. So if someone's under the influence of opioids, they often have sleepy, slow, and slurred speech. If you've ever been prescribed a painkiller after a surgery and you've taken it, you probably have felt those effects yourself, and other people may have witnessed your sleepy, slow, and slurred speech. You sometimes can see someone appear to nod off, like they're going to sleep, kind of the dropping of the head. Muscles will become slack. They'll have difficulty holding themselves up. It is a depressant, so it slows everything down. People may appear disoriented, confused, and have difficulty holding conversations. What happens when someone uses any kind of substance, whether it be as benign as caffeine, which can also be dangerous at times, but caffeine, nicotine, alcohol, or opioids, tolerance slowly builds up within the brain. The brain is an amazing organ in our bodies that realizes, and adapts, realizes that it's getting something in its system, and it can adapt to that. So over time, what happens is that you need more of the drug to get the same desired effect. And even though tolerance builds up slowly, the reverse can happen very quickly. So we want people to be aware that when someone's coming out of prison or rehab or a hospital setting, they tend to be the people at highest risk for an overdose because they don't understand how quickly their tolerance reduced during their time of abstinence, and will often pick up the substance and think that they can handle the same level that they were using before, but their body has adapted to not having the substance and they've lost their tolerance. So if they use the same amount that they had before, they are at risk for an overdose. So what does it look like when someone is experiencing an overdose? This person will look unconscious. They'll be unresponsive. Their breathing will be very, very shallow, very few respirations per minute. There's pale, clammy skin, loss of color or change of color. They may look blue or gray around the lips, caused by the lack of oxygen. You might be able to hear some loud snoring or gurgling noises, or they're not breathing, and their pulse will be very faint, or they may not have a pulse. We talked a little bit about how an overdose occurs, and really what happens in the brain is that your brain has receptors for opioids, and those receptors get filled by the substance, by heroin, by oxycodone, by whatever opioid is being used. And as they fill up, they depress the body. The receptors send signals to the brain to slow things down because it's a depressant, and it depresses the area of the brain that also controls your breathing so that you eventually just stop breathing. So let's talk a little bit about how naloxone works. Naloxone is the generic name for the brand Narcan. Narcan stands for narcotics antagonist. And really what it does is, you saw that picture with the opioids sitting on the receptors. It knocks the opioids off of those receptors, which then signals for the brain to begin breathing again. It's not addictive, so there's no potential for abuse. It is pretty fast acting and temporary, so it wears off within 30 to 90 minutes. And what's really great about naloxone is that it has no effect or harm on the person if opioids are absent. So if the person is not experiencing an opioid overdose and they're administered Narcan or naloxone, nothing will happen to them. There's no harm that's being done. There's no opioids to knock off the receptors, and there's no side effects or no harm that happens to that person. So it's always safe to use, and rather be safe than sorry, and not administer it out of fear that you don't know exactly what's going on with that person. So naloxone counteracts the life-threatening effects of an opioid overdose. And since most overdoses occur in a home setting or a community setting, it was developed for first responders, but also family, friends, and caregivers. It's very simple to administer. The most common administration of Narcan is through a nasal spray, at least, common for people like you and me in the community. I think it's really important, and what we would love to do at SOS Berks is arm everyone in Berks County with a naloxone kit. These kits come with gloves, they come with a mouthpiece to deliver mouth to mouth if that's necessary. They have the spray and an educational insert. If everyone had a kit, we would be prepared at any point in time if we saw someone experiencing an overdose. So let's get into kind of the nitty-gritty of how do you actually respond to an overdose. First, we want to say, do not assume. If you can't get someone to respond to you, they're unresponsive, and you do suspect an overdose, don't assume that they're going to just be able to sleep it off and will wake up. Overdoses can take time before that respiration ceases altogether. So even the smallest action during those hours could save their lives. So don't assume that they're just going to wake up like maybe you might assume if someone had too much alcohol to drink. Before administering naloxone, we suggest that you check to make sure that they're not responding. Look for the signs of the slow breathing or no breathing at all. Listen for the sounds that we talked about. Look for blue lips and nails, cold or clammy skin. And it says here, for darker skinned victims, the skin may appear ashen, but the person's pallor, their general color does not look typical. And they might have tiny pupils if you are able to open their eyes. So if you suspect an overdose, you can try to, clap your hands, yell, "Are you okay?" Try to get them to sort of respond to you. You can rub your knuckles up and down their sternum, or up and down their breastbone, which is, called a sternal rub. For most people, that's pretty painful and would cause us to react if we were able to. And if they are non-responsive, call 911. Before you do anything, the first step is to call 911. Once you call 911, you want to tell the operator that the person's unconscious and that you suspect the overdose. Let them know that you're planning on administering naloxone. You want to give them location and address to where they can find you. If possible, put them on speakerphone. Don't hang up. Keep them on the line. You want someone available to you if you need more assistance as things go through the process. They can help you. And certainly, we want you to protect yourself. If you have gloves, the gloves that come in the kit, wear them. Remove any hazardous materials, any kind of drug paraphernalia that might be in the vicinity, move it aside. If there are people there who are anxious, if there are other people who have used substances, they may be anxious about you calling 911 or them getting into trouble, or just some people don't handle crisis situations calmly. Just ask them to move aside, step aside, and stay calm. And when police do arrive, let them know what you've seen, what you witnessed, what you might have touched, anything like that. But do not touch anything with bare skin. If you're going to move anything, we certainly suggest wear the gloves, because any residue, any form of the substance that touches your skin can be absorbed through the skin. And certainly you don't want to experience any kind of effects from the opioids or other drugs that might have been in the area. So if you come across a substance, the first thing you want to do is don't pick it up without protection, but when you're finished, remove the gloves, wash your hands with soap and water. Don't use hand sanitizer. Hand sanitizer contains alcohol, which opens your pores and can give more surface area for the substance to absorb into your skin, or more pores for the substance to enter your system, which you don't want. So kind of back to administering the nasal Narcan, it's very simple. You stick the nozzle up one nostril and you push the pump once, like you're making an air quote. That will administer the naloxone straight in through their nasal cavities, and it will get into their system. It's important to kind of look at the time. Time sort of can be altered when you're dealing with a crisis. So check the time to be aware of when you administered the first dose. That might come in handy if you need to administer another dose. So after you administer the dose, evaluate them, check them for a response. If there's no response and 3 minutes have gone by and EMS is not there yet, it's okay to administer a second dose of the Narcan. Most kits come with two doses. You can administer a second, and sometimes it takes 2, sometimes it takes 3 doses in order to really effectively knock off those opioids in the brain, knocking them off the receptors. And if the overdose victim does begin to wake up, you want to place them in the recovery position. So, the recovery position really is about putting their heads tilted back slightly so that their airway is open, with a hand to support their head on their side in case there's any vomiting or anything like that. We don't want them to aspirate on their vomit or breathe in their vomit. And you want to put their knee out to stop them from rolling onto their stomach. Once the victim is revived, what's the next step? We want everyone to be prepared that not everyone who received a dose of Narcan wakes up immediately thankful that you've saved their lives. In fact, they're probably feeling very disoriented. They could become belligerent. They could be denying their drug use. They're not fully cognizant of how they're acting and behaving in the moment, and they are likely not feeling very good at this moment. We just knocked a lot of their opioids off of the receptors. And so that's sort of like putting them into an instant withdrawal, which is not going to feel good to that person. So you want to let them know that Narcan has been administered. Let them know that it will wear off in 30 to 90 minutes. So it is important for them to go with the ambulance, to go with the EMS providers. That's an option. They don't have to. We can't force them to go, but we would highly encourage them to go. The Narcan does not flush the opioids out of the system. It just pops them off of those receptors. So there are opioids still in their system. So if they talk about or try to put opioids back in their system, and that may be confusing to you, because how could this person who just was overdosing want to put opioids back into their system? And all I can say is that it is a disease. They are going to feel pretty bad, and the only way they know to feel better is to put those opioids back in their system and get them out of withdrawal. And so while it doesn't make sense, please be empathetic and understand that that may be their first reaction. So in Pennsylvania, it's pretty easy to obtain naloxone. Family and friends can access naloxone by getting a prescription from a doctor, their family doctor, or you can just go to a pharmacy. Dr. Rachel Levine, who's our physician general, issued a standing order, which means we all have a prescription to obtain naloxone. Anyone can go to a pharmacy and let them know that they want to purchase naloxone and get that prescription filled from Dr. Levine. Also, the Council on Chemical Abuse provides naloxone to Berks County residents for free. So if you go to a pharmacy, you'll likely have to pay for it. But Berks County has the Council on Chemical Abuse available to be able to provide it to them for free. And currently, in the situation that we're in with things being closed, COCA is very dedicated to make sure that people have kits, so they will work with you and figure out a safe way to be able to get that kit to you. We want to take this opportunity to really encourage everyone to dispose of their unused medications, participate in medication disposal days, or find a drop box near you. At this point in time, I believe every police department, or almost every police department, has a drop box in their lobby, so it's very easy to access. No one will think anything poorly of you if you take unused medications, any kind of medications. and deposit them in the drop box. They get deposited safely. We don't want to flush medications down the toilet or pour them down the drain because they can get into our water system that way. So any medication is welcome at these drop boxes. I think that this is a heavy topic to deal with or to talk about, so I do want to talk about and leave this session with just something really positive that's been going on. You know, one of the best initiatives that's kind of come from SOS Berks, which is our warm handoff program. And this is really, you know, a joint effort by a lot of different people. But in 2015, Berks County began a 24/7 on-call warm handoff program in the Reading Hospital. And so recovery support specialists would come out to anyone who was admitted to the ER under the suspicion of an opioid use disorder or had used opioids. Because of the success of that program, in May of 2017, those recovery support specialists were embedded into the emergency department. So they were there all the time. It wasn't no longer an on-call situation. We could have somebody talking to a patient, an admitted patient, or an ER patient kind of fairly immediately. And currently we have those same on-call services at Penn State Health. And the statistics from 2019 were really, really positive. On a monthly basis, there were 94 encounters in the hospital and 8 on-call encounters. So you can see when they're hospital-based, when the person is embedded there, we have a lot more success of getting to them before they leave. When they're on call, there's a little bit of a wait time until the specialist gets there, but still we are having positive encounters with people pretty regularly. That's over 100 a month. One last thing I will say about that is that in 2018, the number of people who accepted treatment after they were given a referral, you know, after that recovery support specialist met with the person, 68% of people accepted that treatment referral and went on to get help, which is really a large number of people whose lives were hopefully positively impacted and got treatment and help for their opioid use disorder. So some resources I just want to point out. Again, go to sosberks.org. There's resources there. There's those testimonials that you can view. Also, getnaloxonenow.org. There's another video that you could watch to get more information about administering naloxone. And just want to let you know that we are here and continue to work very hard to stop overdoses and save lives. Thank you for taking time to join me.